Morning, morning, morning. Good morning. Good morning to you.
Good morning to you, Dr. Forde.
Good morning. It's a real pleasure to be here after a long time.
A long, long time. And not being grilled.
Not being grilled.
Not being grilled about numbers. Yes, it's great to have you this morning. Now, right now, Barbados is finding itself in a position whereby we're having a lot of respiratory illnesses. We're managing to catch them quickly from each other if we're in the same household. There might still be a bit of COVID about. How are you managing?
I think ultimately there's probably no one who's listening to me today who has not known somebody right now who has some sort of respiratory illness. And the truth is, this is respiratory season. We know about COVID, we know about all those different challenges, but this is certainly a respiratory season. And there's several viruses circulating around. I think earlier or late last year, one of the things that the WHO came out and said, look, we have a lot of viruses circulating, which are viruses normally circulate, but it seems to be a little bit more than normal. Globally, certainly we have seen at least a 50% increase in the amount of COVID cases from before. In terms of the respiratory syncytial virus, which is one of those other viruses that was around.
Where did that come from?
Oh, that was around.
But we've never heard about it in the same way.
Because we never spoke too much about it. I think one of the things that happened during COVID, which was a good thing, but can be a bad thing, is people wore masks. The transmission of many of these viral illnesses certainly was not circulating as much as before because people had that extra type of protection. Since COVID, people have become a little bit more relaxed, and these things have really come true. So when you think about things like respiratory syncytial virus, sounds very fancy, but it is quite easily spread. And you hear respiratory, so the opposite, the thing that will come to your mind when you hear respiratory is that it's spread only by respiratory methods. That's quite different that's quite different with this one. So yes, it's spread certainly by droplets. So it doesn't go very far, but it's spread by droplet infections. But it's also spread by contact, and this is why certainly in the infectious disease world.
So I need to stop hugging.
I wouldn't go that far. We still need to love each other.
Okay.
But I think one of the things that we really need to look at is hand washing. And watching between individuals. And this particular virus circulates a lot in the young population. So 1-year-olds and less than that certainly can be quite cause quite devastating illness in terms of not only upper respiratory tract infections, but lower respiratory tract. So you hear about things such as pneumonia and bronchiolitis. Those are things you sometimes get in kids, but it can also affect adults as well.
So in terms of the children and that coming on, what are some of the watch signs that parents should be on the alert for?
Right. So often this one usually causes the nose, to get a little bit blocked up. Cough, fever, certainly comes along with it. If you see the kid short of breath or change color, mean they go blue and see oxygen in the blood, certainly has fallen. Certainly you need to seek medical advice. And I think the ultimate thing in this conversation about respiratory illness is I think we've moved certainly in the infectious disease world and in the medical world to really encourage people and encourage Barbadians certainly this morning to take stock of your health. Okay. And this is important. So you recognize the symptoms. If you're getting worse, you're getting short of breath, for example, if you're having very high fevers, you're not eating, you're not drinking, you're a little bit listless, you're fatigued, to seek medical advice early. Because ultimately, I think one of the things is these individuals will end up in our emergency room.
Oh dear.
And cause, a whole set of havoc. And this is not unfamiliar for this time of year, but if you look at what's going on globally in Europe, they were having a multitude of challenges. Even next door to us in the US, they were having a multitude of challenges with a large influx of people into the emergency departments. And you remember that the emergency department is grappling with other things, with the diabetes and the complications of that, with the heart attacks, with the strokes. So ultimately, if you look at all of these things and put them together, what I really want to encourage Barbadians, certainly this morning, is to focus on their health. understand that healthcare is not only the doctor giving you medication,
medication.
but you doing your part. It's really a partnership.
So it's all about boosting our immunity now.
Yeah,
in
it is.
terms of taking in the additional vitamin C, getting lots of sunshine,
Yeah,
and
that's right. And washing your hands.
yes, constantly.
Constantly in this particular environment. But it's also in terms of people getting worse within the disease. It's presented early.
Okay.
And that's one of the things we learned as a country. During COVID, I always tell people say, hey, how comes Barbados did so well? Because I said Barbadians are smart people.
Yes, we are, and we continue to be.
Yeah.
Now, COVID is still around, and we have been seeing new strains in other Caribbean countries. Where are we at now in terms of the types of COVID circulating?
Yeah. Well, I really can't comment on the strain that's circulating this morning, but what I would say is if it's in St. Lucia and it's in Trinidad and some of the other countries, certainly, it's going to be circulating, certainly in Barbados.
Okay.
It is, the GM1, as they call it, is one of the most widely circulated strains globally at this point. It's the most common one, kind of feeding off of almost a subvariant of Omicron, with its spread being about the same. So we're going to expect to see that. And with that, what's happening globally, you've seen the increase in amount of hospitalizations of people, certainly with the disease. So something we have to keep our eyes on.
Okay.
And I go back to what I said before, I should think is really, the mantra, which is people need to take responsibility for their health. If you know you're sick, if you're coughing, you have a cold and fever,
And
look up.
especially if you already have underlying issues.
Exactly. Seek medical advice. I think there's a lot of thing in Barbados, I can do this, man, this is just a low cold, I can, but that's okay if it goes well, but if it goes badly, it often goes,
It comes to you. No, in terms of detecting and making sure that we know what it is that people have, a lot of your work also goes to the labs. We got to find out the name Best Dos Santos during the height of COVID, but the QEH also has a lab, and I know that now with the new system where you have to triage when you present, I guess a lot of stuff will be sent to your labs as well to determine what it is individuals do indeed have.
Yeah, and I made a special point to say this morning that I really wanted to speak about the laboratory. I think they're the hidden champions behind the scenes. So I'll take the opportunity to give a shout out to Mr. Adrian Howard and his team of senior laboratory technicians throughout the laboratory, who play a very important role in the health of Barbadians when it comes to infectious diseases and even non-infectious diseases. I mean, the results and all of the specimens were sent to the lab, which are processed. The information from that goes a long way into what we do as physicians, into people management of highly infectious diseases, but also in non-communicable diseases as well. And I think that sometimes they're not recognized. I just want to take the opportunity to applaud them for the work. There's much to do, certainly within the laboratory. And we've been making special efforts, certainly internally, to try to improve services. And to announce to Barbadians this morning that for the first time in a long time, that we have on board at QEH a new clinical microbiologist. That's a very difficult person to find in the world right now.
I was going to come up to that stuff now because I wanted to find out about those things like the flesh-eating bacteria and all those other things that we can't see or know about but are around and highly infectious. Yeah.
Yes. So I think, look, we're heading we're in a world right now where diseases that you probably never heard of, or you've probably heard in biblical days, that you're seeing reemerge. And some of it has to do with what we're doing. People have become a little bit more liberal in what they do. I heard Dr. Clyde Cave, one of the premier pediatricians, speak about measles, mumps, rubella, and these sort of diseases, which you would have heard about. Yeah, we have vaccines for them. But people, as he said, and I endorse 100% what he said yesterday. People are running away from these things, but these are things that got you to the stage where you're at right now. So I think we need to protect our future. We need to protect our children and move along with these particular aspects. We've seen reemergence. We've heard recently, in Barbados about certainly an imported case of leprosy. People first thing they think about leprosy, they think about disfigurement and these sort of stuff. Yes, you can get skin involvement. Yes, you can get enlarging of the nerves, some issues with the eyes, etc. But it's very difficult to get leprosy, and I had the opportunity. I'll say I had the opportunity to really work with lots of leprosy patients in Manaus, in Brazil, a few years ago. So I'm pretty versed in but it's very difficult to get leprosy. You really have to be in close contact for an extended period of time, and it's spread by droplets. We have to be
Really close.
Yeah.
Okay.
So yeah, although we take note of it, it's not something I'm dramatically worried about at this time.
Are there any other illnesses that we in this part of the world thought were forgotten that we should be on the watch for?
Yeah, so you mentioned leprosy. We've seen cases in the Caribbean countries next door, probably related as well to internal spread, potentially. We talk about measles, we talk about mumps, we talk rubella, and those viral illnesses. One of the things that is also concerning, certainly at this time in the world, is probably thought, to be a part of the world's next pandemic would be bacteria. So we talk about viruses, but bacteria, resistance in bacteria.
This microbial resistance,
antimicrobial
yes.
resistance, which Barbados, I would say, is leading a charge for globally. I think in September, Barbados is supposed to lead this particular area at the UN through our own Prime Minister, who is the chair of the Global Leaders Group, Global Leaders Group,
yes.
and antimicrobial resistance. And basically, to make it really simple, is like we have bugs for which we don't have much antibiotics out there to treat. So I say that.
I've even heard about some venereal infections now being resistant as well.
Exactly. So in the past, it was easy to treat like gonorrhea and these particular things, but it's difficult. And the truth is,
we have a caller. Just
okay, no problem.
Good morning to you.
Good morning, Mama. Happy New Year. Morning, Barbados.
Yes,
Mr.
thank you.
Forde, I am so happy to see you. You look really relaxed. I like your new look. How is that? Yeah, what I want to talk about this morning is, I find that persons are not looking after themselves. Everything you have to come and educate them about. They have a brain in the top of their head, and at least they should know what's going on. When they are in crowded places, they are not wearing their mask. They are up in one another's face, breathing, sneezing, coughing, and because no one is on the TV saying, wear your mask, nobody is wearing it. What do you have to say about that, Mr. Forde?
What I have to say about that is, I thank you. I don't think I need to say it anymore. I think you said it all for me.
It seems that way.
It seems that way. And that's, what she said is the truth. We have to take personal responsibility for our health. If you have a cold and fever and you runny nose, etc., you have to protect your neighbor. Neighbor next door, that person at work. You wear your mask when you have to wear it. Like I keep drumming on the point about hand washing as well, because that's important. So people always think about, yes, somebody sneezes in your face, etc. But if you don't wash your hands, one of the things we do with these,
we tend to touch a lot of things. But COVID actually helped me in realizing how much we really touch. So with the COVID coming up, I was very cautious about things like stairwells, knobs, etc., because we do leave a lot of germs on those surfaces.
And you don't know who was there before you.
And what infectious disease they might have transmitted onto that surface.
And it's not about scaring people. It really is not. You hear infectious diseases and you go like afraid. It's not about scaring people. If you do the things which everybody knows is right, that's why I said Barbadians are very intelligent people. And this is how we were able to ride through a pandemic and not look like the rest of the world in any way. It's because Barbadians are very intelligent people. So, today when I say, look, be cautious, and I always say I don't come and speak unless I think, I need to speak.
Yes.
And I think that people just need to do what they know is right. Wash your hands, wear your mask when you need to, or you think you're going to be exposed. If you're immunocompromised, you have your diabetes, you have other challenges, be cautious. Kidney disease, for example, certainly be cautious. And then one of the other areas I'll finish off with here is Of course, during COVID, people were, I don't use the word locked away, but they were isolated together in their homes. After COVID, everybody went free. And one of the things we need to watch very carefully as well in country certainly is spread of sexually transmitted diseases.
Okay.
And people need not to be reckless, but need to be careful with their health. Yeah.
Okay. We have a caller on the line. Good morning. Go right ahead with your question.
Good morning. Can I ask Dr. Forde if we can go back a little? I've been reading up on cholera. I realized that we have a lot of information on cholera, but there's no information I can find at all about Spanish flu and another epidemic, in fact, a pandemic. I think it is in 1927. Barbados seemed to be affected. Is there any way we can get figures to show these two things, the 1918 and 1927, I think it was?
Okay.
Okay, it's interesting you mentioned cholera. In terms of the Spanish flu, if you leave your information, I'll send it to you personally. But in terms of things like cholera is, again, and was up in the region in recent times. If you remember, there was an outbreak of cholera, certainly in Haiti. And there was, we know what that was related to. So, and then there was a worry. I think there were some cases which were picked up in Bahamas, which was just next door, etc. So I think it's something that we always have our eyes on. I just need to let the public know, as the infectious disease guys in the hospital, the infection prevention control in the hospital, and certainly at the Ministry of Health, that these are things that we have a very keen eye and we are watching for. So anything that's weird or odd in the community, they're on it. This is how we were able to pick up a dengue outbreak within Barbados, because people don't know, but there are numbers and figures which are coming in from across the country, across multiple healthcare systems. So if something looks odd or off, you know, we drop people on the ground. Yes, we drop people on the ground. It's part of a massive surveillance national program.
What about things like checking our water, both wastewater as well as the potable water, to see if it's bringing any strains of bacteria, what have you, that could possibly lead to outbreaks? Because there's one thing among children that's awful, the hand, foot, and mouth disease.
Yes. So I think what you're saying is very important. Again, this is all part of a massive surveillance program. So we also think about things like dengue, but in terms of waterborne illness, there are units within the Ministry of Health that look at that. They look at, you know, how we're, you know, what's in our water. There are actually studies done right here in Barbados with University of West Indies looking at our water system to see what is in there. So we found some very interesting bugs, certainly, which have resistance to more common antibiotics. So those are things that help guide the platform of what is done, certainly within the countries. And we're not the only country that does that. It's a global thing, and a global platform to look to see.
It's the new surveillance methodology.
Exactly, and I'll say that even in respect to COVID, I think with the new variant which is there, I think many countries would have found in their runoffs, and certainly water, a large population of viruses, which means that it's really vivid and rapid within the community. So this is something that is part of a massive national surveillance program. And I think only yesterday there was a meeting on issues regarding to infection prevention control at the Ministry of Health, because we have a National Infection Prevention Control Committee, which really looks at all of the different healthcare entities across the country, gather information and talk about how we can improve things and get things better. And I said it like 10 times already on this show, but again, every single bar is a partnership that we have with the average Barbadian out there. And I think they need to understand that they're going to have to play a massive role
in dealing with it.
In dealing with these things with us. It's not us working to stop these things, but every Barbadian needs to do
an all-in approach, as I like to term it.
An all-in approach. And I specifically want to mention this. I can't leave today without mentioning this. And in terms of your neighborhoods, how can you, your neighborhood, stop the movement of infectious disease? A simple mosquito, which is smaller than you, carries a virus, right, which can cause a death of an individual. And each of us in our communities have the capacity to do it. There are many abandoned cars, some in my neighborhood, mind you, about the
I'm tired
country.
Of seeing MO8 sprayed on them.
Right. So, and it's those bottles, coconut husk, all of these things can help with the breeding of the mosquito. And you might do your job in where you live, but your neighbor next door needs to do their job, right? the neighbor on the other side needs to do a job. It needs to be a collective effort among Barbadians to try to quell our outbreak of this nation. Certainly, we've seen a decrease in the amount of cases. Certainly, our improvement, I should say, to be careful in saying that. But every single Barbadian has their role to play.
Okay.
It's not just a Ministry of Health problem.
We have another caller. Good morning
Thank
to you.
Yeah, good morning, Wendy.
Yes, go right ahead with your question.
To you, I want to tell Dr. Forde that he looked more like a preacher than a doctor this morning.
I think he's feeling quite safe. Yes, so go ahead with your question.
I say Happy New Year to you, both you and him.
Yes.
But my question is that normally on the COVID, that the doctor doesn't normally come and give you a update on the statistics. And that's probably why you're having this lackadaisical people wearing masks and things.
Okay, I think he's saying that the numbers that you used to bring out before helped in terms of keeping people in check.
Well, that may be partly true. And thanks for your comments. Blessings. But I think the ultimate thing here, and though that might be true, I think every single Barbadian needs to understand, and I go back, I say it again, go back to what I said before. So even though numbers are helpful and will help some individuals, I think ultimately people just need to understand where we're at. And this is something we're going to have to live with. And I think for most of us in the infectious disease world, we have to figure out how we continue to live with this, because economies need to survive, people need to move, tourism needs to occur is one of the major things in our country. So all of these things need to continue. We need to figure out how to do that well within our environment. The hospital needs to continue, right? So, you know, I applaud him for making the comment. But I think ultimately it really comes back to the partnership I mentioned just now at healthcare. I think we need to move to a point in healthcare where healthcare is a partnership with your physician and not a physician-driven event.
Okay. Now, before you go off, I want to find out, we've talked all about the prevention, but I want to find out what our capacity is should these infectious diseases come. Should we have antimicrobial resistance? Do we have a quarantine? I remember there was a special infectious center at the old Enmore. Is that still operative? Is Harrison Point still operative?
Right, so Harson's Point is actually closed at this point.
Stood down.
It's stood down at this point. And, you know, it's really where we are in country. We still have the active center and more infectious disease center, and we still isolate people there, right? So if you have an infectious disease that we're not really sure what it is, or we know what it is and it's something that can spread certainly within the hospital system to affect people who have reduced immune systems, we certainly would do that isolation. So that's still there, still active. We still have ongoing training in the process. I think this is very important. It's one of the things we have to learn from the pandemic, that this needs to be a continuous training process. I think one of the beautiful things that certainly has occurred in Barbados is that during the pandemic, we trained a lot of people in managing infectious disease. Some of them have gone on now in the community to do other things with their life. But we now know within our own country that we have a hidden capacity. So should we get into trouble, we can call people
to call on.
That's right.
That's great.
That's right. So we now have certainly that capacity, whether it be housekeepers and orderlies. And I shout out all the people who worked tirelessly during the pandemic yet again. So we do have that capacity. I think where we are at right now in terms of infectious diseases is having a ramp up certainly our surveillance program, because and I always tell people, and I always tell my regional people, international partners, and when I speak internationally, that we in the Caribbean always hope that it happens somewhere else and we have the capacity to respond, a given time to respond. But ultimately as a country, we need to think carefully about that particular aspect. Who says it can't start here in Barbados
and
or somewhere
to the others?
And somewhere in the Caribbean? And I'm very mindful of that, and that's why training certainly becomes important. And Barbadians need to be vigilant. If you see something you think is strange, you need to come forward. Seek the advice of your friendly doctors, your friendly nurses, and know that we're going to do our ultimate best to get you back to the sort of health that you should be, but you need to work with us.
Okay, and I thank you for working with me this morning, Dr. the Most
Wonderful.
Honourable Corey Forde, talking all about infectious diseases. Thank you, our callers, for posing your questions to us.
Morning, morning, morning. Good morning. Good morning to you.